Hi, my name is Dr. Cozy. It's really nice to meet you. And I see in your paperwork that we have you here today because you've been experiencing some facial twitching. Where are you experiencing it on your face? Okay. Is it just the left side? Okay. When did it start? Okay. Is it constant? Does it get more intense, or maybe does it lessen at certain times of the day? Okay. Every morning? Have you done anything or tried anything to relieve the spasms? Okay, and did it help? Not really, okay. Is this interfering with your ability to sleep or function throughout the day? Okay. Any pain associated with the twitching? Okay. And any history of Bell's palsy? All right. Okay. Just looking at your medication list and your history there. Okay. So I would like to start by physically examining your face, feeling the tone of the facial musculature, and I'll also be palpating to assess your sensation, rule out the presence of any numb areas, okay? Okay. Are you okay with me touching your face? Great, thank you. So, okay. I'm gonna start with the forehead. So to begin with, are you able to feel that? Okay. See here a bit of a brow furrower. I'm the same way. You can tell because these muscles are very toned here. And I meant to ask, have you done any kind of cosmetic procedure on your face, such as like a dermal filler, Sculptura, Botox? Okay. Just wanted to rule that out because sometimes the placement of those injectables can interfere with the nerve structure in our face. Okay. I'm going to move on to your cheeks. Can you feel that? How about... Okay. I'm going to press on the corners of your jaw. Can I have you open your mouth for me? Good. And close. And again. Close. And now on your chin. Are you able to feel that? And along your jaw, you're able to feel. All right. So, I don't want you to move your head at all, okay? Just using your eyes, I'd like you to follow my finger, alright? So just track its movement. Yep, just like that. Now we're going to do a bit of a faster movement here. Any strain? All right. All right. Focus your gaze right here, right in between my eyebrows, please. Yes. Do your best to keep your eyes open. I'm just gonna take a look here. vessels on the surface of the eye look okay? I'm going to take a look at the vessels on the inside. So, just stare straight ahead. Those look okay too. Alright. So now I just want you to sit, just relax your face, okay? I'm going to be checking your facial symmetry, looking for evidence of any kind of facial drooping that may be subtle at this point. Can I have you smile for me? Give me a really cheesy grin. Yep, hold it. Okay, now furrow your eyebrows. No, like a sad face. Okay, relax your face. So what I would like to do with you right now is perform an EMG or electromyography test, which will help us determine if a blood vessel is present that is pressing and kind of pulsing on a nerve that can cause that hemifacial spasm that you have occurring here. So what that means is that I'm going to be applying some electrodes to your face, alright? And you will feel kind of like a static, shocking sensation. It shouldn't be painful, but it can be a bit uncomfortable. It won't last very long, but getting this reading can sort of help me start to get an idea of what we need to do to make this go away. If I'm not able to get answers through the EMG, then we will order you an MRI and see if we can see what's going on that way. But usually these tests give us some good answers pretty simply. So are you wearing any makeup? Okay. I'm going to clean your face with an alcohol wipe just to make sure that we remove any kind of oils or skincare products that might interfere with the connection of the electrodes on the skin. They need to be able to stick properly so that the readings are accurate. So these also have some tiny little needles on them that will go into the skin, but it's no wider than an acupuncture needle, so you should barely feel that. Alright, so it looks like we have a pretty good connection here. So you should start to feel sort of like a buzzing on your skin. No. Is that okay? Okay. It can be a little intense at first, but then most people do manage to get used to it somewhat. Yep. And there it is. Okay. So it does appear that we do have a vessel that is overlapping a nerve right under your left eye. And that is causing those hemifacial spasms. Go ahead and take these off. So what I would like to do to start is to actually start by working with some Botox. What that will do is paralyze these muscles, which will stop the spasming and give that nerve a chance to calm down, because the vessel's irritating it quite a bit. When we have constant irritation like that, it can cause inflammation. And just check here that you're not on any medications that will contraindicate that. interactions there. So if the Botox is not tolerated well, or it doesn't stop the twitching, we can change to a microvascular decompression procedure, but that would be more invasive. So I would like to start with Botox and then reevaluate in about 3 or 4 months and see how you're doing. If the Botox doesn't last that time, or it's just not stopping the twitch, then we will examine different options for treatment. All right. Okay. It does take about 24 hours to 48 hours for the muscles to paralyze, at least with the first injection. Subsequent injections will kick in more quickly. And it's very important that for the next 24 hours, you refrain from any exercise, hot baths or saunas, any kind of smoking, alcohol. These things can alter the body chemistry and actually allow the Botox to migrate to areas where you may not want it to go. So, very important that for at least the first 24 hours, you take it kind of easy, okay? Okay. So, I get that drawn up. Oh dear, get off my thumb. We're going to do 4 units, okay? And let me just disinfect where we're going to inject. Alright. So feel free to close your eyes if it helps, okay? All done there. So the areas that I injected are away enough from your eye that there shouldn't be any issue. That being said, every now and then someone is an exception. So if you start noticing you're having a difficult time closing or opening your eye or moving your eye around, give me a call, okay? And I'll have you come in right away so we can take care of that. Okay. Let me just write up a note here. Like I said, any funny business with your eye, excuse me, I want you to call me right away. We will get you in immediately, even if it's after hours. If I am not in the office, I do have an answering service and they will page me, okay? Okay. In the meantime, I do want you to return to clinic in 3 to 4 months. So that way we can reassess, see if the Botox is helping, or if we need to do something more invasive to take care of the issue. If, and sometimes this happens, the Botox metabolizes more quickly and that paralyzation wears off earlier, then I want you to make an appointment and we'll get you in sooner, okay? Okay. Do you have any questions for me? Well, if you think of anything, please feel free to give me a call, and I will be calling you in about 48 hours to check in and see how you're doing, okay? Okay. See you in 3 months.